It's only been a few weeks of distancing for Canadians, but doesn't it already look strange to see people out together, so close together? Strange, too, to know these aren't old pictures. This is Singapore days ago, a densely populated city-state of 6 million making huge leaps at confronting COVID-19. Only 1,000 cases, less than half a dozen deaths. Look at its enviously flat curve, and now look at Canada's. The contact tracers of Singapore are crucial. Their detective work identified more than 50% of all cases, most people who had no idea they were infected. One trace can take hours with each person who tests positive.
So we go down breakfast, lunch, dinner, supper, and tea if it's in between, and then we traced out who are the people that for each of those contacts they could have come in contact with.
Then, in partnership with police, contacts are visited, they sign agreements to stay quarantined, and know it's jail if they don't. It's so effective, some commerce has been able to stay open. So how's Canada faring on contact tracing?
So the majority of jurisdictions actually have for now, but a few have said, look, if the cases go up in the next couple of weeks, we're going to need some help.
They will need help and will likely turn to a place like this, a tracing center in Alberta. The province leads the way in mobilizing tracers, public health nurses in conjunction with newly trained medical students. Over 300 of them taught how to do this by Rochelle Schindler.
That whole team together is doing every single case in Alberta right now. So I believe that's about 60 a day. And we're definitely not maxed out. We can do more.
It's picking apart credit card statements, bus schedules, helping someone already stressed remember vital details. Initially, some thought contact tracing would only be effective in the early days, that the virus would eventually outpace efforts to chase it. Success stories prove that wrong.
One thing we've learned from China, South Korea, Japan, is that you never stop doing this work. Through aggressive contact tracing and isolation of contacts, they were able to get it under control.
If you think you can help do this, she advises, consider contacting public health agencies. They may soon need more Canadians to step up.